Assalamualaikum and hi guys! So today we will be sharing about the rehabilitation process after a total knee replacement surgery.
Let me introduce my team. My name is Amira.
Hi, my name is Auni Afika.
My name is Putri Eliza Izora.
I'm Nurzawana binti Muhammad Nizam.
Let's move to our main purpose of this video. By any chance, what is knee surgery? Knee replacement surgery or knee arthroplasty is surgery to replace all or some of your knee joint. Your surgeon will replace damaged cartilage and bone with a prosthetic joint. It can take up to a year to recover fully after a knee replacement, but you'll be able to resume some of your usual activities gradually as you heal. A knee replacement is surgery to replace all or some of your knee joint. It's a type of procedure called an arthroplasty, joint replacement. A surgeon will remove damaged parts of your natural knee joint and replace them with an artificial joint, a prosthesis made of metal and plastic. There's two types of knee replacement. The first one is total knee replacement. Total knee replacement is the most common type of knee replacement. Your surgeon will replace all three areas of your knee joint: the inside, medial, outside, lateral, and under your kneecap, patellofemoral. There is also partial knee replacement. A partial knee replacement is just what it sounds like. Your surgeon will only replace some areas of your knee joint, usually if only one or two areas are damaged. Partial knee replacements are more common in younger adults who experience an injury or trauma. Got it? We got a patient. Let's see what he reported to us. Patients complain of painful over his knee, especially when walking and going upstairs. The area of knee are swollen. Let's move to patient history. His name is Mr. Shabil. His age is 42 and he is male. His disease is osteoarthritis. The other complication that he's got is obesity and smoking. As we all listen and know just then, Mr. Shabil's disease are osteoarthritis. What is it actually? Come, let's talk about it. It occurs when the protective cartilage that cushions the end of the bones wears down over time. Although osteoarthritis can damage any joint, the disorder most commonly affects joints in your hands, knees, hips, and spine. But how? Osteoarthritis occurs when the cartilage that cushions the end of bones in your joints gradually deteriorates. Cartilage is a firm, slippery tissues that enable nearly frictionless joint movement. Eventually, if the cartilage wears down completely, bone will rub on bone. Osteoarthritis has often been referred to as a wear and tear disease. But besides the breakdown of cartilage, osteoarthritis affects the entire joint. It causes changes in the bone and deterioration of the connective tissues that hold the joint together and attach muscle to bone. It also causes inflammation of the joint lining. As Mrs. Shabil disease, what are the conditions recommended to do total knee surgery? We can do total knee surgery when severe knee pain or stiffness that limits everyday activities including walking, climbing stairs, and getting in and out of chairs. It may be hard to walk more than a few blocks without significant pain, and it may be necessary to use a cane or walker. Next, moderate or severe knee pain while resting either day or night. Furthermore, failure to substantially improve with other treatment such as anti-inflammatory medication, cortisone injection, lubricating injection, physical therapy, or other surgeries. Additionally, chronic knee inflammation and swelling that does not improve with rest or medications.
Let's move on to our patient's assessment. We use the standardized assessment to assess the patient's range of motion capability and strength outcome. While to assess our patient's occupational performance, or specifically the patient's activities of daily living, we use the non-standardized assessment. To assess patient's range of motion, we use 4 actions and movements, which are flexion, extension, internal rotation, and external rotation of the knee. we use the goniometer to measure patient A ROM. As we can see by patient A results, his ROM of the knee is optimal. Mr. Shabil's strength outcome are tested using the manual muscle testing. Based on the Oxford scale, we found that his knee flexion and extension is normal in power. Let's move on to our non-standardized assessment. We use the Modified Bartle Index to assess his occupational performance in ADLs, or specifically, activities of daily living. From the results collected, we found that Mr. Shabil has trouble in bathing, toileting, and dressing.
From that, we identified a few problems. First, with bathing, Shabil struggles to bend down to wash his legs or feet and has difficulty stabilizing his body, which increased fall risks. Next, in dressing, he's experienced difficulty putting on and removing pants, as well as bending and lifting the leg to put on shoes. Finally, with toileting, he finds it hard to bend his knee when sitting down and standing up from a standard toilet seat.
Next, let's discuss about the intervention plan for our patient Shabil. First, for bathing, the goal is to improve Shabil's bathing skills using assistive modalities such as a non-slip mat to reduce the risk of slipping, as he has a hard time stabilizing the body while showering. Besides that, a long-handled brush can help him reach and wash his legs without straining. The implementation involves using aids during bathing to ensure safety and comfort. Next, for toileting, the focus is on enhancing independence by making necessary modifications. The plan includes installing grab bars for stability and using raised toilet to minimize knee strain. The implementation ensures that these modifications are set up to support his recovery and make toileting safer and more manageable. Lastly, for dressing, the intervention plan for Shabil is to improve dressing pants using aids devices, such as a long-handled shoehorn, sock aid, and a dressing stick. Now, let's watch a demonstration video on how to use the sock aid. By placing the sock over the aid and sliding the foot through, the tool reduces strain on the knee and promotes safe and effortless dressing. Simply slide the shoehorn into the shoe and pull the foot out. Same thing with putting the shoe on. Hold the shoe with the long-handled shoehorn and slide the foot in. Lastly, this is how to use a dressing stick. Place the operated foot in the pan of the legs and use the dressing stick to help slide the pants up your leg until they are at a point where you can easily reach them, usually at about or above knee level. And then stand safely and pull the pants the rest of the way up your legs.
The outcome: after total knee replacement surgery, the patient, Shabil, can expect a full recovery within 2 to 3 months. He will be able to bend his knee up to 90 to 120 degrees, perform daily activities like walking long distance, and experience better improvement than before. Overall, this leads to a successful discharge and improved quality of life. In conclusion, assessments like ROM, MMT, along with tools such as MBI, are important for measuring a patient after surgery. And occupational therapy intervention using like non-slip mats, grab bars, long-handled brushes, and dressing tools helps patients regain independence in daily activities. That's all. Thank you for watching. Bye bye.